All right. So let's go ahead and kick off. So today's webinar will be, as the title says, why you still feel bloated even when you eat clean. This is going to be presented by Samuel Lewis Saint, who is the functional medicine and nurse practitioner here at SNS Health and Wellness Center. So if we can move on to the next slide. So we have to do this and put the disclaimer out there. So this webinar is for educational and informational purposes only, is not intended to serve as medical advice, any diagnosis or treatment. This is more informational, like I said before, just to learn more about your body. If there is any further questions, our nurse practitioner does have consults that any one of you can sign up to spend 15 minutes and learn from him. But of course, if there's anything medical, any treatments, diagnosis, you definitely want to go the right route. Make sure you're talking to your medical provider as well as taking advantage of that consult. Next slide, please. All right. So today, this is what we have on the agenda for you. So we're going to go over the difference between functional and traditional medicine. And then we're going to swap over and start talking about the impact of stress on bloating. So really how your mental state affects your physical body. And then we'll dive into the role of the guts cleanup crew. So this is a really interesting topic and something that I feel like most people are not aware of. So I'm super excited to dig into that. And then the final thing is supporting digestion beyond clean eating. So we'll share some practical tips that you can take back, start implementing today, and really start to see differences in your body. So without further ado, I'll hand it over to Samuel to go ahead and kick us off.
All right, can you hear me now? Perfect. Well, thank you, everyone. Welcome to our second webinar. I'm very excited to be here and to be sharing all those good information with you all. This is really exciting, and this become my passion where I share all the information, everything that I know that will help someone or more than one person out there, health-wise. Again, my name is Samuel Lewis, and for those who do not know me, I am a functional medicine practitioner. I'm a nurse practitioner, board certified, also a certified medical examiner. I've been in the medical field for about a decade now, and I earned all my nursing degree in Boston, Massachusetts. So I recently moved to Georgia um, about 3 years ago with my wife. And now I am very passionate about functional medicine, which I also do traditional medicine, but my passion now is functional medicine because this helped me really make a difference in our patients, where we look at the root causes of their ongoing issues and help them with getting the answer that they've been asking for, um, probably for the longest time. So before we continue to the title of the webinar, I want to make sure that you all understand the difference between functional medicine and traditional medicine. So functional medicine is what I am currently practicing, which focuses on the root cause of the problem, versus traditional medicine, which is going to your primary care doctor annually or doing follow-ups, which is always good. But this approach focus on more treating the symptoms. I would say suppressing the symptoms. Just simple example, if you come to me as a traditional practitioner and you say that, hey, Mr. Samuel, I have, this bloating, I am constipated, I don't know what to do. So what I will do as a traditional medicine provider, I probably will prescribe you Colace or any laxative to help relieve with the constipation. However, that does not really solve the problem, the root cause of the problem, which is why I love functional medicine, because that make me feel better when I see long-term results. And when I deep dive with the patient about what is going on, you are constipated, why you are constipated. So let dive deeper into it. Let's run some advanced functional labs instead of the regular labs. Um, I will run as a traditional medicine provider. All right. As stated, so we are going to learn why eating healthy sometimes cannot fix your whatever problem you're going through, whether losing weight or the bloating or the constipation. Eating healthy foods sometimes cannot be the only strategy that will help you get that relief. And if you've been eating healthy, you've been exercising, you've been doing all the right things, which is great, that's a plus, and you still not getting the result that you need or your goal, then it means there is something deeper that is going on into your body that you need to seek for guidance. That's where functional medicine comes in. So before we start talking about the impact on stress, of stress on bloating, let's define what stress is. I'm pretty sure most of you, if not all of you, know what stress is, but let's just take our time to really understand, the stressors, different type, and what it does to the body. As stated on the screen, the stress is the body's natural way of reacting to something challenging or overwhelming. So stress is good. When you're stressed and it helps you stay focused, it gives you that alert that you need for a short period of time. And so it's a really good thing. Stress overall is not a bad thing, but chronic stress, which I will talk more on the next slide, that's when things start being very concerning. So looking at the different type of stresses, we have the travel stress. Some people, they are not probably not aware of travel stress. Yes, this exists. Travel stress is, for example, when you eat unfamiliar food. People who love to travel, which is amazing. You like to go to explore other cultures, try different food, which is great. But your body is probably not used to those type of food and the microbe and from the food. So whenever you introduce unfamiliar food to your body, then your gut will be like, hey, what's going on? There is something new that is just introduced to the gut system. Let's try to find out. So sometimes the the body just panic a little bit just because they're not used to the food. But if you start slowly introducing that food slowly to the body, then the body will be like, okay, so I'm used to it. That's fine. I can give you a very simple example. Coming from Haiti to the United States, there are food that I used to eat back in Haiti, and for some reason, I cannot eat them here, like avocado, which is a great, great food. I love avocado growing up in Haiti, but when I come here, for some reason, I don't like avocado. Until now, I still don't like it. So my gut is still not really okay with that, whatever microbe is in the avocado in the US. And then moving on there, work stress. I know a lot of you are going through a lot of stress at work. And sometimes you are, let's say if you've been working for 5, 10 years at the same place, you might be so stressed and you don't even notice that. And when you come home, maybe your spouse or your family, your friends will probably pick on you and say, hey, like you look very stressed or something is off. Then you're probably in denial and saying that everything is fine, I'm good, but you are in very constant stress, which is not good. That is why it is really important to acknowledge the stress and make sure that you know the type of stress that you have in order to address it. And we have the emotional stress. I know there are a lot of moms here, father, um, people in a relationship, family issues. that really put a toll on us, just being very emotional and just living in this era right now. It is very emotional, and we just try to adapt to the reality and just telling ourselves that it is okay, it is normal to live that way, while it is really not. Unfortunately, this probably your lifestyle. And then we have the physical stress and the mental overload. People who like to multitask, or maybe you don't like to multitask, but you have to multitask. Let's say, for example, you have a kid and you have to work. So you have to really multitask, making sure that you take care of your kids and take care of other things and yourself. And a lot of the time, I see a lot of patients, they say that, they put themselves last, which is understandable, but that can affect you, badly, unfortunately. And I usually say, you cannot give on an empty cup. So if you don't take care of yourself, then whoever you're taking care of will probably miss on you later on. So that is stress in general. And again, there's a good stress where you need that stress in order to stay alert, because there is a two hormones that is released from your adrenal gland. That's called adrenaline. You're probably familiar with that. And then the cortisol. Those two hormones, when they activated, they keep you very alert, very focused temporarily, which is good. However, all out of all those stressors, the body itself does not always know the difference. And what it does, it just respond. The body responds to the stressor the same way by pulling away from resources, the digestion, which is why we're going to deep dive today. So one of the resources that the chronic stress pull away from is the vagus nerve. So vagus nerve is the longest cranial nerve in the body. It is a way that the brain communicates with the rest of the body. So if you are in constant stress, what happens is that the vagus nerve is disrupted, which means that your brain is not communicating with the rest of your body, especially your gut, effectively. And that can cause inflammation, it can cause gut issues and weight struggles. And out of the vagus nerve, there is something called vagal tone. The vagal tone is how you measure how well the vagus nerve is functioning. So the vagal tone is, well, the vagus nerve starting right from your brain, as you can see it over there, and it's connected to your vocal cord, and it goes to your chest, and then your entire organ. It goes to your digestive system, it goes to everywhere. So what happened is when you're in chronic stress, it reduces the vagal tone, which is what you don't want. If you were in the last webinar, you probably remember I talked about two nervous system, the sympathetic nervous system and the parasympathetic nervous system. And remember, the parasympathetic nervous system is the rest and digest mode. However, the sympathetic nervous system is the fight or flight mode. This is what you don't want long term, especially when you're in chronic stress. What it does to the body, it says, hey, let's continue to remain on the fight or flight. Then whenever your body is in the fight or flight, what happened? The first thing it does, it shut down the digestion. 100%, it shut it down. Why? Because your digestive system needs a lot of blood supplies to really digest the food and absorb the food, and expel the food as well. So whenever you are in the fight or flight mode, you're very stressed. Now your digestion is off. That is one of the major problems that we're going to talk about. So what happened when your digestion is off? So whenever your digestion is off, your stomach acid that usually kills very bad toxin, the harmful bacteria that goes into your stomach, it interfere with it. So what happens there is now the bacteria will be like, okay, so that is very low stomach acid. I can survive that. Then they will survive the acidic area in your stomach and then go right down to your small intestine. So whenever those bacteria, they go to your small intestine, they start multiplying, they start overgrowing. Why? Because there is a slow process um, in your digestive tract just because you're in the fight or flight mode. And then one thing too that people really don't realize is that the stomach acid does not only kill the toxin, it also helped break down the protein, which I mentioned the last 2 weeks. But it helps with absorbing nutrients like minerals, iron, magnesium, and calcium, and all the good stuff. So just imagine like you are in the fight or flight. Maybe you know, maybe you don't know. A lot of the time you don't know because it seems normal to you. You're living a stressful life. It's fine, you're good, but in reality, you're not good. So something else that the stomach acid does, which is really important, is it activates a protein called intrinsic factor. That protein is very key to absorb vitamin B12. And in the next webinar, I'm going to deep dive into the vitamin B12 and how it breaks down and everything that the body needs to do in order to absorb that vitamin B12. So you can imagine that, okay, so I'm in a chronic stress. I probably don't know. And I'm still trying to eat like healthy food. I'm like, what's going on? I'm still bloated. I'm still not losing the weight. But you're denying that you are in a very bad, stressful moment that you need to address first. And then something else that the chronic stress does to the body is that it activates the systematic inflammation in your body. Now, let's take a pause. Systematic inflammation is very normal. It is actually great. It helps the body fight off threats. Let's say, for example, if you're walking down the street and then accidentally you hit your head. So what's going to happen? There's going to be some inflammation on your head. So that's what happens. So the nervous system communicate with the immune system, delegate some tasks, say, hey, there is a danger, a threat, or something. You know, the head got hit, so go protect it. So that's why the systematic inflammation run there and then start protecting that area, which is great temporarily though. However, when you're in chronic stress, so then now the systematic inflammation continue to go through your body. So what it does, the first thing that it does is that it interfere with your insulin production, especially if you're diabetic. If you're diabetic, you might have this experience. You will see that your blood sugar spike whenever you stress, not just your blood pressure, your blood sugar is also. Why? Is because the inflammation interfere with the insulin. So now the sugar that's in your body is now just living their best life. They're like, okay, so there's no insulin to regulate us, so we're just going to do whatever we want. So that's how our blood sugar start spiking. And then also something else it does, it activate the hormone that I spoke earlier, which is the cortisol hormone, which is a good hormone. However, in a stressful moment, constant stressful moment, that hormone is not good. What it does, it helps facilitate the fat absorption. So now your body is basically absorbing fat, which is something that you probably don't want. And back to the sugar, what the sugar does as well, your body normally just having sugar in your system is perfectly fine. because you got the insulin that's going to regulate it. And also you need to exercise and move around so you can burn the sugar. But if you do not burn that sugar, what will happen? So the sugar will eventually store as fat, especially around your belly. So now you can start thinking by saying, okay, so maybe, that's a reason, maybe it's not, but this is one of many reasons why, even if you're eating healthy, if you have that stressful lifestyle, it will definitely interfere with your digestion and just storing fat all over your body. Now we're going to talk about the gut cleanup crew. So the gut cleanup crew is something that is very cool. We all have that gut cleanup crew. It is called migrating motor complex, but I call it gut cleanup crew because that's exactly what it does to your body. So let's say you eat today, right now. After you're done eating, the MMC wave, that's the short way of saying it, MMC wave, which is the migrating motor complex, it stopped. It only activates whenever you're done eating. So if you're not eating, then 1 hour after eating, it'll start activating. So what it does, it basically it goes to your digestive tract and then get rid of all the undigested food from your gut because you need that to happen. Why? Because if you keep undigested food in your gut, then the bacteria will start overgrowing and then ferment in your small intestine, and you do not want that to happen because whenever there is fermentation in your small intestine, what happened? You're gonna be bloated easily. You're gonna be very gassy, and you may have that uncomfortable feelings in your stomach that you probably won't be able to describe. So it is really, really important to make sure you let that cleanup crew does its job. How? You have to wait about 3 to 4 hours between meals to let that happen. Because an hour, that's when it starts doing its job. And then it takes about 60 to 90 minutes to complete. And then it will stop, whenever you introduce food in your mouth. Let's say if you're eating right now and then you're done, and then let's say after like 45 minutes or an hour, you take a snack. You just feel like, eating a snack. Then you will interrupt the MMC wave. So basically, you know that the food that you ate earlier is not fully digested. It didn't get rid of your gut. So that becomes a very problem, especially for bloating. So now, how do you support your digestion beyond eating clean? Again, eating clean is very good. If you're eating clean, continue to do it. If you're exercising, yes, do it. But if you see that you are still not losing the weight, you're still feeling bloated, it simply means that there is something else going on that you need to find out. What I'm saying to you right now are maybe 3 or 4 out of 100 reasons that may cause you to be bloated, even if you're eating healthy food. So to enhance the vagal tone that we spoke earlier, I'm going to give you some simple technique that you can start using today in the comfort of your own home to improve the vagal tone. Remember, whenever you improve your vagal tone, now you activate the parasympathetic nervous system, which is the digest and then rest mode. So the first technique is deep breathing exercise. I know it may sound very simple, deep breathing exercise, but it is really, really helpful, and especially in helping you digest food normally. Why? So whenever you take a deep breath, maybe doing meditation or for any other reason, what happened is that the receptor in your lungs or your diaphragm sense the slow, deep breathing, and then it sends a signal to your vagus nerve right in your brain. And then the vagus nerve sends a signal to the brain saying that, hey, relax. That's basically what it does. You take a deep breath, your lungs sense that very slow, deep breathing, and then send a signal to say, hey, it's time to activate, to strengthening the vagal tone so you can be in the rest and digest mode. That's something that I never used to do it, to be honest, but now we start incorporating that, and it's really, really helpful because by just doing a deep breathing, just adding that to your daily activities, it'll make a huge difference, even more better result than taking another pill. And then the second one is the cold showers. So typically cold just trigger stress, cold or anything that's unusual or anything that's not comfortable to the body temperature, it'll trigger the stress. Why this is good is because whenever you take a cold shower, it trains the vagus nerve by telling the vagus nerve to remain calm in stress. That's how it strengthens the vagal tone. You will take something cold or maybe washing your face with cold water, and the body will be like, whoa, this is cold. Then it'll probably start activating the sympathetic nervous system, which is the fight or flight, to maybe increase your heart rate. However, the vagal tone will now activate and then tell your body, hey, just relax. It is just cold water. And then that's how it trains the vagal tone. And then it's strengthening it. And then it'll put your body right back to the rest and digest mode. And then the yoga. Some people do yoga. I I've never done it, but it is really helpful. It's one of the great techniques that can help you remain in that digest and then rest mode. So what it does, so usually if you understand or you know what yoga is, and doing yoga, you're expected to maintain a very slow and deep breathing despite challenges posture. So you would probably do like some straining exercise and maybe like moving like around, like stretching really hard. And then when you're doing this, usually the body will tell you, hey, you are straining, so we need to increase the heart rate, and they send the signal to the lung to start breathing heavily. But now the yoga, it's a requirement. It like challenges you to take a slow and deep breath despite challenging postures. So by doing that, it basically teaches you how to stay calm, balanced, in a steady mindset. So that will enhance your vagal tone. And then the last one, which is chanting, singing, and humming. I know it may sound boring for some people who do not like to sing, but by chanting or singing or humming, you actually stimulating the vagus nerve, because remember the vagus nerve starts from your brain and then it goes down, it's connected to your vocal cord and goes down to the entire organ. So by just humming, singing, and chanting, you are actually vibrating the throat, which helps stimulate the vagus nerve and sending that calm signal to your brain into your gut. And then for the MMC wave, which is the cleanup crew, like I said earlier, you need to give yourself at least 3 to 4 hours between meals. Don't don't be snacking all the time. If you keep interrupting the MMC wave, you already know that there is a big possibility for bacteria overgrowth in your stomach or in your small intestine, and especially in your small intestine. Whenever the bacteria overgrow in your small intestine, like I said, it starts fermenting early. and you don't want that to happen. You want the food to go down to your colon so it can start fermenting. But if you're not letting the MMC wave do its job, and then you interrupt it with another snack, you're only going to build up more bacteria, and then that's going to cause you to be continue to be bloating and have that uncomfortable feeling that you cannot get rid of. And then another practice that I always say to my patient is that after every time you're done eating, don't just go laying on the couch. Do some movement. Go for a walk for 5-10 minutes. That helps stimulate the digestive tract. Because if you eat and then you go to bed, for example, then that will slow down your digestive system, because especially at night, your digestive system kind of slow down a little bit more. It doesn't work as effective as if you were, active, or you're in the morning, doing things. So the big takeaway is that low vagal tone and poor stress management can sometimes be the missing piece behind bloating, especially for those people who eat clean. It is really important to continue do those daily exercise at no cost. That probably will save you tons of money, to be honest, and then keep you away from taking unnecessary medications, to be frankly honest. And by doing this, you will feel a lot different. And that's something that you can do every day. Just, I don't know, if you go to the shower, or you like to sing, or maybe if you don't like to sing, start singing. That will absolutely activate the digest and then rest mode, because we are in a lot of stress, and that includes me. Sometimes I will be in a lot of stress and not even knowing if I'm stressed. And my wife will be, "Hey, you're not okay." And I'm like, "Really? I'm fine." And then I realized that I was really not okay. So it is very important to make sure that you acknowledge the stressors that going on into your life, and just know that it is not normal just to be in that position, and also know the impact of that by staying in the fight or flight mode, which will again turn off your digestion system, and that will cause all the process that go into your stomach to be very slow and sluggish and cause bloating. All right, this is pretty much it for now. I know there is a lot more that I wanted to say, but I want to be respectful of your time. I know you probably had a long day, so did I, and you took your time to be here and learn with us, which we know that knowledge is power. And I want to thank you all for taking your time out of your busy schedule to really participate in that webinar. So our next webinar, we're going to talk about what most doctors miss when it comes to fatigue. Fatigue, again, is not normal. It is not normal. I have to say that to myself, because when you move so much, you have so much going on, you think fatigue is just okay, you're gonna be fine, but it is not okay. There's a lot that comes with fatigue, and there's a lot of things that is often missed by a traditional provider. Most of the time is because they only have 15 to 20 minutes to take care of you. And if you say that you're fatigued, just one simple example about that. Let's say if you're eating healthy, you're eating a lot of vitamin B12. Vitamin B12 come from like animal product food. So you're eating that and you're still feeling that fatigue, and then you go to the doctor, what they're gonna do? They're going to probably give you, B12 injection or something to help you to boost your energy. However, does that really get to the root cause of you being very fatigued? Absolutely not. This is where functional medicine comes in. But I want to say functional medicine does not replace traditional medicine. I do both. I do functional and traditional medicine. traditional medicine is often for acute problem. Let's say if you have a brain bleed, yes, you need traditional medicine to maybe have surgery or take care of that right away. But if you have something chronic, something that is unexplained, and you keep going to your doctor saying that, hey, I don't understand. I'm doing everything right, but I still have this problem. That's when functional medicine comes in place. And it really help you deep dive into what is going on, ask further question, and do advanced lab, not the simple lab, the advanced lab that only functional medicine providers can order. And also, I'm going to talk about coffee. I know a lot of you drink coffee. I drink coffee too. There are things about coffee that you need to know. And next webinar, we'll deep dive into that as well. So that concludes the today's webinar. And again, I want to thank you. And if you have any questions, I will be more than happy to answer them for you.
We have one question from B. He asks, what if someone works a night shift 11 p.m. to 7 a.m.? Is a regular 9 to 5 or a 3 to 11 p.m. shift? What eating tips would you recommend to prevent bloating?
I will say to you, unfortunately, I used to work night shift. It's unfortunate, and sometimes we have to do it. But eating at night is really going to make you bloated even more because you by now you know that at night your digestive tract slows down naturally. It is not your fault. It's just a natural thing. And by eating at night as well, you'll continue to have that premature fermentation that occur in in your small intestine. So really the tip is to eat before you start your shift. If you're working 7 to 7, 7 p to 7 a, before you go to work, try to eat a good sized meal. And then you will just have that's my advice to you because I don't know everything that's going on, your health wise, because sometimes some people they probably cannot, last 4 or 5 hours without eating if you're diabetic or have any other problem. But there is another tip, which is give your digestive system 12 hours of rest. It is really key. That's something that I do and it doesn't bother me. But if you can tolerate that, you will do it. I will eat 7 p.m. today. So I ate before the webinar. And the next time I will eat will be 7 a.m. or later when I get to work doing breakfast. So just giving your digestive system this gap, the 12 hours rest will really help. But if you're hungry overnight, then you have to eat something, then you have to eat something. You just have to weigh the good, versus the bad. And then, you just have to weigh. It doesn't matter if you eat healthy food at night, you will still, it'll still slows down your the passage in your digestive tract from your stomach to your small intestine and your colon. So unfortunately, there is nothing much that I can say to really stop you from being bloated by working overnight. And it's unfortunate because this is probably, your lifestyle. That's what you do on a daily basis. But again, it's can you, you know, not eat for 12 hours? Is that feasible for you? Only you can answer that. And also there are some supplements that may be helpful as well. Some very good supplements that could be helpful. But it's not something that I can tell you because I don't know your health history. And, it's really important to know your health history and everything about you health wise in order to really tell you exactly, what you need to do. But I can give you general advice, and that is it.
Um, we had one comment, Sandra, that she's gonna sing her way to sexiness. But if there are any other questions, please feel free to drop it in the chat, or you can choose to unmute and ask your question live. So just raise your hand if you do have a question and we will unmute you. There's a question in the chat. Do we have a social media page for Facebook, Instagram? Yes, we do. I'll drop it in the chat.
Yes, and actually it's really good. We have also we do have Facebook and Instagram, and we post daily. Except on the weekends. Sometimes we don't post on the weekends, but like Monday to Friday, we'll be posting some tips and things that you can actually utilize that'll be very helpful for you. Things you probably did not know, or your doctor probably didn't mention to you. And these are really, great tips that's actually working right now and helping you with your issues. So we talk about everything: hormonal imbalance, gut issues, stubborn weight, and premenopause, postmenopause, and everything. So yes. And I want to say something too. I know in Haiti, it's really interesting. Growing up in Haiti, when you hear farting, someone who has a stinky fart, sometimes you might think it's cool, or yes, my fart is very stinky, so I'm going to get you, and stuff like that. Now that I learn, sometimes just having that foul smell when you fart can be an indication of uh, your stomach not digesting the protein appropriately. So whenever the stomach acid that I talked about earlier, whenever you don't have enough stomach acid, then you, of course, not be able to digest the protein, and then that will cause you to have that foul smell when you fart. So just putting it out there. And I know I, I didn't know about it until I became a functional medicine provider. Then I'm like, oh, okay. So there's a lot of things that the body's, you know, is telling us that we think it's normal, or we think it doesn't mean anything, but actually the body is talking to you. And I'll say, listen to your body whenever your body is talking to you. And we often say that your gut is your second brain because it is connected to your brain, and it interferes with your brain big time. All right. If there are any, all right, no more questions. Perfect. Well, I again thank you all for your time. I know it's now 7:48, so I will give you your time back. And like I said, the next webinar is actually in 2 weeks, May 8th at 7 p.m. the same time. So if you have any question in between, please don't hesitate to reach out, because there's a lot that we can talk about, but I have to keep it within the 30 minutes time frame, and give you, limited information, but very essential information that will help you with any problem that you may be having right now. And I hope this was very informative for you guys. And don't forget, the vagal tone is really important. It is really important, and it really helps with the calming phase. And take care of yourself. Please take care of yourself. Just acknowledge what's going on, and then start with the simple things. When you start with the simple things, now it puts you in a better position to know, okay, this is exactly what's going on. That's how I can tackle it. So again, guys, thank you very, very much. I hope you have a great night, and I will see you May 8th and at 7 p.m. And I will give you a freebie. I don't, are we giving him? Okay. So we're gonna give you guys a freebie, like some strategies that will be very helpful for you. Hopefully, Irby, that will be helpful for you as well. Some like things that you need to do, things that you should not do. So yes, so you're welcome and thank you. Thank you. I see Lux 2022. Thank you guys. I appreciate you. And Shirley will drop the freebie and also the recording will be released very soon because I know not everybody have, the opportunity to assist the webinar around this time, but which I understand. So that's why we record it. That's the only reason we record it so we can share it with the other people so they can benefit from it. So again, thank you guys. I will see you guys in 2 weeks, May 8th. And take care of yourself. Practice the deep breathing exercise. I hope you take away something. And I challenge you next time I come, I will ask, or shall we ask, what have you done? And I'm hopeful that one of you at least will say that you've tried, sorry, something. And I assure you, it will be very helpful for you. Because I know we like to see the result, but sometimes we don't need to see the result. The body will feel the result by just doing what you need to do. Again, thank you guys. I This conclude the webinar for today, and I hope you guys have a great night, and we will stop the recording very shortly. Have a great night. Thank you.